Up next, everyone, we have Michael Merkerin, Regional Sales Manager with Centene, talking to us today about Ambetter plans, improvements, and so much more. Michael has been with Centene for over 6 years. His knowledge will surely shine through this presentation. Michael, thanks again for being here. If you're up and ready and your microphone's on, you may take it away, sir, at any time.
All right. Thanks, Vincent. Appreciate it. You guys hear me okay on your end?
Absolutely perfect. Thank you, sir.
Cool, cool. So thank you for the introduction. Like Vincent, my name is Mike Mulcairn. I've been with Centene for, I think this is going to be my seventh or eighth open enrollment now. I am a regional manager over here. So we call it the Southeast region, but, it's Florida, North Carolina, South Carolina, and not very Southeast. Pennsylvania, New Jersey, and Delaware are under my purview. But the beauty kind of Ambetter is, we're a national brand. We've been in the market for, since the inception of the ACA. Our plans, tend to be pretty universal state by state. So I'll kind of dive into some of that today, but, want to give you some updates on some new plan designs that we think are going to be competitive, some network highlights. I'll talk to some of the states that we feel like we're going to be very competitive, and just some things as far as the broker portal that'll help you, some tips and tricks. And then also on the member side, the member portal, so we'll go through kind of high level everything associated with Ambetter for you as a broker. So hopefully this will help you. Hopefully for some of you, it's a review. So with that, we'll kick it off. So first, just kind of want to give you, if you're newly contracted with Ambetter or you're not super familiar with us, we are America's #1 marketplace health insurer as far as membership. So I know sometimes, I'll be the first to take my Ambetter hat off and say, hey, sometimes the name doesn't pop like a Blue Cross or, a Cigna, Aetna, some of the carriers that folks are used to seeing on the group side. But we have about 4.5 million members. I think that slide, we bumped it up over the month. We're up to about 4.5 now. So about 1 in 7 folks on the marketplace have an Ambetter plan with us. We're in 29 states. The only caveat really to that is California and New York, a little bit different entity. We have Fidelis in New York, and then we have Health Net in California. That they're under the Ambetter kind of blanket, but they function a little bit more independently just because of the way those states function and some of the regulations there. The nice thing about all of our plans, though, so we are in these 29 states. We're a national brand, like I mentioned, but we do have a local health plan in every state. We work in conjunction with them on events, community events, broker events. I was just in Charlotte yesterday, actually, for an event where we had local brokers and the health planners there. They were able to answer some questions on, providers, different things that are going on in just that state. So it's great that, again, being a national brand, we still have a local presence and a local footprint with folks that are going to be in the same areas as your members. And again, we've been on the marketplace since 2013, since the inception of the ACA. We've expanded our footprint this year into Iowa. We dropped New Mexico out of our footprint for this year for 2025. It's a state-based exchange. Really, it was just more of a competitiveness thing. That's really the only time in my time here at Ambetter, and really in our time at all, that we dropped the state off. Just some of the nuances with New Mexico. But so if you have some members there, they're already informed, and they'll be routed to the most similar plan on the exchange. Yeah. So what's new for 2025? And some of these slides you'll see here, Florida tends to be kind of our catch-all state. It's our most diverse as far as plan design. So a lot of these slides you'll see, we'll talk about Florida, but this information is pretty universal. So first, our bronze, silver, gold network, we called it core last year. For the upcoming open enrollment, we're referring it to premier. So we'll get into the finder provider later. But what this network is, it's our full boat network. Everything that is in the Ambetter network will be a part of this premier network. We have some tiered HMO networks throughout the country. In Florida, we pulled our select portfolio, but you'll see it in Georgia. That's like our most competitive plan. These are HMOs that don't require a referral on the select. In Atlanta, I think would be kind of the best example. We have a plan that's designed with Wellstar. And the way that plan functions is, it's a slimmer network. It's the Wellstar network. Members have access to all of the Wellstar network, hospitals, facilities, specialists, PCP groups, but that is the only network that they can use. We're introducing some condition-specific plans for members with diabetes through the Premier Network, kind of a pilot program this year. There's going to be about 5 or 6 states. We have that in Florida, North Carolina, a few others. We did some expansion in Florida, and we've done some expansion across all of our states. I think Pennsylvania is probably the biggest one. That state-based exchange, we added 11 new counties to our footprint. We released an app in July of 2024. I'll say this, I don't know if heading into 2025, you can brag too much that you have an app, but we do have it. I'm excited about it. I think it'll help, for the member experience. Essentially, the app is going to be the member portal in a mobile version. Something for you guys as brokers that we're doing, we're adding the renewal letters to the broker portal here. So I think, this time of year, we're all carriers, not just us, we're required to send out renewal notices to members. The issue being a lot of the data as far as what their expected premium could be is based off of subsidies for the current plan year, not what's going to happen the next year. So a lot of times, these folks get these renewal letters and it says, oh, hey, my premium's going way up. That's not actually going to be the reality on November 1st when the new subsidizations are put into play. Something you'll see in Florida, and you're going to see this in some of our other states, we're trying to change some of our branding. In Florida, if you sold a plan in the past, you've seen Ambetter from Sunshine Health. Sunshine Health is that local health plan that I talked about that services the members. They do the provider contract negotiations. We're going to list all of our plans as just Ambetter Health moving forward. And this is going to kind of help from a branding perspective. I think with providers, it's going to make it easier for providers to kind of know when they see somebody come in with an Ambetter card. Oh, hey, Ambetter Health. I know that there's some things with some of the health plans, like they have the Medicaid contract. Sometimes people come in with a card that says, Ambetter from Sunshine Health, and the provider may think it's a Medicaid member when it's actually an ACA member. Out here, especially for Florida, this is something that's new for this year. The Premier Network, so our full bore network. In the past, we've extended the binder payment out to typically the end of January. The DOI wants folks to get these payments in prior to 1/1. I would always tell brokers and easier said than done, right? But we really recommend folks get that binder payment in before the first of the year anyway. We don't want somebody to not have their plan active on 1/1, but that's something that's new in Florida. I believe there might be a few other states out there that is going to be a requirement this year as well. So, and then across the board, I did mention we have the Ambetter Select. It's going to be in Georgia. We're actually retiring those in most markets. Lower membership on it. It's not really going to be much of a change for your members. There aren't a lot of people in those plans. And then the virtual access plans are going to be retired as well. Those were some, an idea that kind of came out of the COVID era. It's a virtual first plan. You had a $0 copay if you had a virtual visit, and then there was a separate copay for in-person. But yeah, that's some of the kind of the highlights for what's new this year. And I did want to kind of touch on some of our states. So this is our county coverage for Florida. We're almost statewide. There's a handful of, Flagler, Taylor, Hendry, and Monroe are really the only few that we are not in. But and if you look at this county coverage here, you'll notice a couple different colors schemes for the for the county names. But counties that have that kind of like orange, yellowish orange, that's the value portfolio. So that is a HMO product that does require referrals. Slimmer network, a lot of these are kind of, clinic-based plans, but then they're associated with hospital networks. For example, in Jacksonville, UF Shands is kind of the anchor. Down in Miami, we have a pretty broad, it's essentially our full network for the value plan minus University of Miami. But again, these are plans that are more cost effective. They're slimmer network. But, I think in most markets, you're going to see a pretty good option with the Premier as well. And then just some highlights for Florida on the premier or on the provider side. I do want to give the caveat. This is just a small portion of the network. Any of these network slides you see today, don't take this to the bank of, hey, this is all that Ambetter has. This is just some of the highlights we want to talk about. So in Broward, we have Broward Health, Holy Cross, Memorial, Hillsborough. We're partnered. We have multiple locations of Advent Health, Tampa General. We added Baycare last year. I'll say this. I think when we talk about like where we're going to be really competitive in Florida, Central Florida for sure. Tampa, Orlando, Jacksonville, up in the Panhandle. We're going to have probably the lowest cost silver in just about every county. Some other highlights here: Orlando, we have Orlando Health. Miami-Dade, it's Hialeah Hospital, Jackson, Kendall, Larkin, Memorial, Mercy. MD Now is an urgent care provider that we have kind of throughout the state. A lot of their locations just happen to be down in Miami. Fort Myers, we have Lehigh, and then Palm Beach, Good Samaritan, JFK, St. Mary's, and then Jacksonville, like I mentioned earlier, UF Shan. Then Georgia, wanted to touch on Georgia. We feel really strongly like we're going to be competitive in the Atlanta market, down in Savannah, some of the more rural counties as well. But this is just kind of a highlight of where we're at. Again, just missing a handful of counties. Really, if you ever see kind of a gap in our county coverage, it's usually we're in the process of negotiating, some network piece that we need to have. I know up in that northeast portion of Georgia there's like one hospital group that kind of they have all the facilities. So, getting a deal with them is kind of the only way that you can get into those counties. So we're in the process of doing that. And then some provider highlights here. Again, kind of looking at the premier network in Chatham County, there's Chandler, Memorial, St. Joseph's. Over in Fulton, we have Emory, Grady, Northside, Piedmont, Wellstar, Gwinnett, Eastside, Emory, Northside Hospital, Gwinnett, Northside Hospital, Duluth, Gwinnett Clinics, Wellstar, North Fulton Hospital. And then that select network. So again, like I said, we retired this in most markets, but in Georgia, we had a lot of membership on these select plans. So, and again, how these work is, these plans are designed to be with one network. So up in the Atlanta area, we have Wellstar, and we have a plan that's with Piedmont as well. We also, getting out of Atlanta, we have a plan partnered with St. Joseph, and then Gwinnett as well. And then Pennsylvania, I do want to throw in the caveat. I am aware of this state-based exchange. I know sometimes that can kind of be a little bit of a non-starter for brokers because, a lot of the platforms don't participate with some of the state-based exchanges. I will say this, when we talk about, compliance and things like that and AOR changes, the state-based exchanges are a great place if you're dealing with that on the marketplace. They have a lot of different, things in place like dual factor authentication that make it, really hard. We don't see that on our end as a carrier, any really, issues of AOR switches. We're going to be really competitive in Pennsylvania. I wouldn't completely put it out of mind. We are in the Philadelphia area. We've gotten kind of in the central, and as you start to get to southwestern Pennsylvania, I originally grew up in Pittsburgh, in Allegheny County. We're not quite in there, but we're in some of the surrounding counties. We feel like we're going to have a price advantage it's going to be pretty substantial, like $20 to $30 in just about every single county that we're in. So, I think it's a good opportunity for you as a broker. I know it's a different platform that you have to use, but there's a lot of opportunity. I think for agents, the little extra time that you do have to spend doing an enrollment in some of these state-based exchanges, those enrollments are a lot stickier. And from a commission standpoint, they're going to be a little bit more lucrative because it's going to stay on the books for you all year long. Provider highlights here. In Philadelphia, we have essentially every hospital network minus Temple. We have Chester County, Penn Medicine, Jefferson, Tower, Shriners Hospitals for Children. We actually have Shriners kind of throughout most of our footprint. As you get outside of Philly, Lehigh Valley, Lower Bucks, St. Mary's, Lower Bucks Hospital, Coordinated Health Hospital of Allentown, Reading Hospital, Up in Lucerne and Lackawanna County, we have Geisinger. So Geisinger is a pretty major hospital network throughout the state of Pennsylvania. We have them in 2 counties today, and then we're looking for, plan year 2026 to expand that relationship. That'll help us grow our footprint within the state as well. In Westmoreland County, we have Independence Health Center. So that's kind of the state college area, if you're familiar with Penn State. Mount Nittany Medical Center. Cambria, we have Duke Life Point, and then Fayette, Penn Highlands Hospital, and then Uniontown Hospital, which was purchased by WVU Medicine. Again, just some highlights here on the Premier portfolio. So again, this is our broadest network. It's available in every county. That condition-specific plan that I talked about will be offered in Florida. It'll be offered in some other states. It is only on the Premier network. Members can visit any in-network provider. No referrals needed. I'll say this, a big thing that the selling point with these plans as well is, it's a national network. The example I use a lot is folks that live in, say, York County, South Carolina. A lot of them work and spend a lot of their time across the border in Charlotte. You're able to use that plan across state lines. And that goes for, no matter where you're at with the Premier network. I know there's a lot of, this time of year you start hearing about the snowbirds heading south. These folks can have a plan in Indiana, a Premier plan in Indiana. They can use the Premier network anywhere throughout the country. We also have adult vision and dental buy-ups on these plans as well. And then wanted to kind of hop into a couple plan grids. What you're going to see here today, obviously we have more than the plans I'm going to show, but we wanted to kind of highlight where we feel the plans that we think are going to be the most competitive throughout the year. The Focus Silver, I think it's probably our number 1 plan, existing plan today. It's our lowest cost silver plan that has, co-pays for PCP, specialist, lab, urgent care, generic and RX. Just kind of, I think you guys are probably all aware, but how to read this chart. The base is folks that don't qualify for, the cost share reductions. The 94% is the lowest income, and they are getting the most CSR. They're getting the most cost share reductions. So this is a $0 deductible plan, $1,350 max out of pocket, co-insurance of 30%, virtual care, $0. I'll talk about that today. So we're partnering with Teladoc. They're a great, I'd say they're a great resource for members. I always use kind of the example of like when you have a sinus infection and you don't really want to go to the urgent care, you don't really feel like getting off the couch. I've used Teladoc before. Members can register with their card. That way, Teladoc knows to send us the claim. Pretty much all of our plans minus the HSA that are out there, depending on the state, have that $0 copay. And the reason why we don't have it on the HSA is it's an ACA rule. We're just not allowed to do that. PCP visit, $0, specialist, $15, lab, $0, preferred and generic RX. So you'll see that's kind of tiered. On this plan, it's $0, but some plans you'll see say like a $0 or a $10 or a $5 and a $10. On the formulary list, we have a tier. It's tier 1. Tier 1 has tier 1A and tier 1B. When you're looking at the grids, tier 1A is the again, for this plan, it's a tough example because it's $0. If you look at the 87, it gives it a little bit better of an idea here. So it's 3 at the 87. That's tier 1A. Tier 1B is $10. We had an issue last year with Health Sherpa early on in open enrollment that they were not, if you ever use some of those filters, it was quoting it a little inaccurately. It wasn't splitting up that. We've since corrected that, but just so you guys are aware, it's tier 1B is the higher dollar amount. And then preferred RX, these are tier 1 or tier 2, tier 3 drugs, a little bit higher, some of the more name brand. And then urgent care visits, $10 on this plan as well. The standard silver, you've probably seen this in the past. It's the CMS standard plan that they designed for all the carriers. We all have to offer it. The design is exactly the same. The nuances from carrier to carrier are just going to be like our network partnerships, and then obviously pricing. So this is another $0 deductible plan, $2,000 max out of pocket, co-insurance 25%. The virtual care again $0, $0 for PCP. Specialists are $10. Lab has a 25% co-insurance. Preferred and generic 0 and 0 again. Preferred 15, and then urgent care is $5. Then the everyday gold, I'll throw this out there. There's a county in Florida, Broward County, obviously Fort Lauderdale area. Not sure how it happened from an actuarial standpoint, but our gold plan is cheaper than some of the silver plans that are out there. So that's kind of a weird, thing that popped up from an actuarial side. You'll see the everyday gold. It's usually our most competitive gold plan in all markets, but that, Brower is one I want to call out. Again, I think gold, not that, I think you guys are for the most part probably aware, but gold are for folks that, higher income, they don't qualify for some of those cost share reductions. The plans are a little bit more benefit rich compared to, if you're on a silver, not getting any subsidization. So $750 deductible, $7,000 max out of pocket, 35% co-insurance, that $0 copay for the virtual visit, $35 for PCP, $55 for specialist labs, or $35. The preferred generic is free, and then the generic RX $15, preferred $60, and then the urgent care $35. And wanted to go over our adult vision and dental. So this is available on some of the premier plans we have. The way when you're quoting, whether you're using Sherpa or any of the third parties or healthcare.gov, it's built into the premium. So, I'll use Focus Silver as an example. You'll see Focus Silver quoted, and then a little bit farther down, you'll see Focus Silver plus vision and dental. On the vision side, we cover glasses up to $130. Same with contact lenses, your eye exam, $0 copay. Fittings for specialty lenses are covered up to $50. We have, for the Find a Provider, if you go into our Find a Provider and do a search, whether it's for vision and dental, what it does is it gives you a link. Once you do the search for, say, an ophthalmologist in, Charlotte, North Carolina, it'll give you a link to go out to another directory that will have the vision and the dental. We did change the name. We were using Evolve, so it's going to be called Centene this year. Again, just kind of hoping that will help a little bit continuity across the country for providers to be a little bit more familiar with the plan. And this is, it's our network. We build it out. It varies from state to state. There aren't, any preferred, like a Vision Works or anything like that. It is our own network that we build out in each state. And no waiting periods on these plans either. And then for the dental, so really kind of your routine, cleaning, oral exam, x-rays, things like that, $0 copay. For anything more than just kind of your routine, your kind of typical yearly cleaning visit, it's going to have a 50% co-insurance. We have a maximum benefit of $1,000 per person per calendar year. So a little bit flip side to the medical side. We're used to talking about max out of pocket. Once you hit that all falls on the carrier. For the dental, it's the reverse, right? So when you hit that $1,000 as a member, it all falls on the member at that point. This coverage only applies to the in-network. Again, this is, a network we build out. Again, no waiting periods for this, and you'll see this again as it's built into the premium. You'll see a plan that'll say Focus Silver plus vision and dental. Off exchange plans. So we do have some off exchange in all of our states. We also have, we're doing a pilot program in about 5 or 6 states this year. I think South Carolina, Georgia, Indiana. I can't think of there's a handful of others out there that we're doing ICRA. So we are piloting ICRA as well. But for off exchange plans, we have a Health Sherpa platform in your broker portal that you can do the off exchange enrollments on. I think a lot of you guys are probably familiar with that first question, kind of when you get into Health Sherpa. Would you like to see if you qualify for financial assistance, yes or no? You're going to want to select no, and that'll show the off exchange plan. The design's very similar for the off exchange is what you see on exchange. Obviously, just some of these co-pays and things like that. A lot, they're not predestined upon the the CSR levels on the silver. So you're going to see lower out-of-pocket expenses. Same network as well for the off exchange is what you would see on exchange. Like I mentioned, we have about 4.5 million members today. How did we get there? A lot of those is through brokers. I would say probably about 55, 60%, depending on the state of enrollment that we get is brokered. I don't have, actually, I think we just sent it out yesterday. I'm not going to go into like specifics on commission, but We do have competitive commissions. We always try to either be the top in a state if we can, or at least right in the ballpark with the other carriers. Competitive commissions, we don't differentiate between new and renewal. Everybody has an account executive at Ambetter. So whether you know it or not, there's somebody that works with you specifically. So, if you ever have any questions or anything like that, please reach out to the account executive. We also have a broker sales support team. So they're great with like tech support. Hey, I'm having an issue with my broker portal. I can't log in, or, my member made a payment, but it's not showing up in the portal. Can we take a look? They can do some back end research to get those, solved. And then also the broker portal. I'm a fan of our broker portal. I think for the most part, occasionally, like anything, you can have a tech glitch, but as far as what you're able to do in the broker portal, we'll kind of go through some tips and tricks today. But I do think our broker portal, is pretty close, if not the industry standard. And with the broker portal, like I mentioned, we're going to kind of dive into it. So this is kind of the homepage that you'll see when you log into your broker portal, and the URL is down there. It's broker.ambetterhealth.com. Once you log in, you'll see this homepage here. The first three kind of things we call out are your total active members. Ideally, all of you guys have at least 1,700 members. That would be awesome. Delinquencies. So these are people that are, 30 days delinquent, 60 days delinquent, 90 days delinquent. Unpaid binder payments. I think that's a big one, that come as we're in this season of open enrollment. You enroll a client, but they haven't made their binder payment. All of this, you can't really see it on the screenshot, but underneath there's a hyperlink to view. It'll pull a list for you of all the folks that fall into these categories. So the policies tab. So if you see kind of up on the top, there's a banner that runs across. There's the home, which was the screen that we were just looking at. There's the policies tab. That is what we're looking at currently. So the policies tab has all the members that are, associated with you're listed as the agent of record. A couple different ways you can filter this. All is everything. So everything in your, that we have you listed as the agent of record, whether they're active, inactive. We also have the active tab that you can filter for, showing all your members that are active and paid up to date. Delinquent, again, folks that are, behind on their payments. Unpaid, looking at unpaid premiums or unpaid binder payments. APTC decrease is something we threw in there recently. These are folks, it is retroactive. It's not, we don't have a line of sight to see prior to us getting a new file, but I always think about tax time, right? Like when folks have to put in their documents, if they don't do so, their tax credit can decrease, it can go away entirely. Once we get that, we're able to call that out here in the broker portal to show you that, hey, we got a file for, member John Smith and they lost their subsidy. Canceled, and then agent's another feature we just added, I believe last year. These are folks, I want to say 6 months from when they age into Medicare. We call that out here. All of this you can filter really any which way you'd like. You can sort the columns, but the big thing is you can export this into an Excel file. I think it makes it a little bit easier to intake. If you're doing payment outreach, things along those lines, you can use an Excel. If you have office staff, that helps. I think this is a great tool for you to be able to pull these lists and sort on your end. Within the policies tab, we have the policy number. It's hyperlinked. If you click on that, it takes you to the member details. So really, this is everything associated with the plan. You can see, what's the full cost premium? What's a member's advanced premium tax credit? What's their member responsibility? How much do they actually owe premium each month? You can see all the dependents information on here. You can see if members are enrolled in My Health Pays. My Health Pays is a rewards program we have for members. We'll talk about it here in a little bit. You can order ID cards in here. A new thing for this year, you can set up auto pay for members in any state. Last year we started it in a handful of our states. Now you can do it across the whole Ambetter footprint. You can set up auto pay for a member in your broker portal. You'll also be able to see those renewal letters that I talked about. They'll be in here as well. And I know I just talked about auto pay, recent change here over the last few weeks, so I apologize. The slide's a little dated, but it does say, those states there, Arizona, Florida, Indiana, Michigan, New Mexico, Nevada, PA, Texas, and Washington, for the auto pay. You can now do that everywhere within our footprint. we kind of already highlighted this. You can pull the binder payments. You can pull the delinquency reports through here, so I won't kind of beat a dead horse with that. Some other, easy access menu here. So the quick pay. So I know I talked about auto pay, but if you're doing payment outreach and we're talking more like a one-time payment, you can hit the quick pay. It'll take you to the payment portal. So if you have somebody on the phone, hey, member, you need to make your February premium payment. You can do the one-time payment here for a client through the quick pay link. Enroll a client now. That's the Health Sherpa that I mentioned. It is, it's Ambetter centric. It doesn't quote other, other carriers. As much as I'd love to think that 100% of your book's going to be with Ambetter, I highly doubt that's going to be the case. This is really where you would do those off-exchange enrollments. And then the find a provider, rather than having to go to our main website, ambetterhealth.com, you can access the find a provider from your broker portal. And another tab that we have within the broker portal, I think this is super helpful, is the resource tab. So forms, we're kind of in a blackout period with all these, so not going to highlight too much. But if you ever need a release form or direct broker form or principal change form, those are going to be in there. Training materials, I think that's the biggest thing this time of year. We're adding more and more each day as things get signed off on from a compliance. So you're going to see plan grids in here. Usually every year we have a great kind of side by side of all the plans in a specific state. You can see all the different cost shares, side by side. I think that's helpful for you as an agent. Kind of an easy playbook when you're quoting to kind of, okay, hey, I see these 2 or 3 plans might make sense for you, member. Here's the differences in some of the cost share. We'll have product trainings that are in there. We've been doing some webinars for all of our states, and like today, having the opportunity to speak to you guys directly is awesome. We do that with some of our agencies. But then also, if there's everything, hey, I want to learn a little bit more about this specific state, we'll have videos in there for, say Indiana or Illinois or Georgia, all of our states, we have a training in there. And then also reference guides. So, tips and tricks on the broker portal, things like that are in here. Marketing materials. So they're state specific. We have a social media guide, kind of like do's and don'ts for social media. There's also usually some curated posts that you can use. And then everything in the broker portal is bilingual. Most of our documents are either they have an English version and a Spanish version. So member benefits. So I want to kind of dive into this. My Health Pays, our rewards program, a couple different other things that we offer our members. So members can earn up to $500 in rewards. I'll say this from a compliant aspect. We saw a lot of last year and a lot of complaints of, ads being out there of just, hey, sign up and get $500. That's not how this works. We don't want to be talked about that way. It's very misleading to do so. Members, they can earn points and they can earn dollars, but they have to earn them. They're not just given. So they earn points by completing specific health screening. Clinical rewards include doing the onboarding and well-being surveys. So these are for new people, new members to us, that it's essentially a health questionnaire. They fill that out, they can get about $50 worth of points. Doing your annual exam, your PCP wellness visit, so your physical each year, you can earn points that way. Some comprehensive diabetes screening. And then some quality measures, right, for children, vision and screening, getting their immunizations. For women, cervical and breast cancer screenings. For men, cholesterol, colorectal screenings, and then for adults, just in general, blood pressure screenings. As we get the claims, and if somebody's signed up for My Health Pays, they will get those points in their portal. So how they get signed up, they'll get this in their welcome packet as well when they become a member. But they go to their member portal, they log in, they go to the rewards tab, they click Get Started, and that'll sign them up for My Health Pays. And some other ways that they can earn. So they can earn points by participating in fun and easy activities. They're centered around eating right, moving more, being well, saving smart. Kind of an example, there's usually a video or an activity in there about getting out and walking and hitting a certain amount of steps each day. If members do that, we'll put points in their portal. They can use these points to shop in our online reward store. I'll say this, it's not Amazon. We don't do next day shipping. There's really nothing in that store that they need. What I always recommend folks do is they convert those points into dollars. So again, talking about like they can earn up to $500. They do these, screenings, they do these activities, they can earn these points, right? Then they can convert the points into dollars. We send out an Ambetter Visa debit card, very similar to like a Visa gift card. They can use this to pay premium and other health related costs. Another program we offer is through Ambetter. It's a rewards program. If you ever kind of worked like a corporate job, I think it's very similar a lot of times. Like there's employee discount programs that companies offer. So Ambetter is a third party. They offer discounts on like gym memberships. They offer discounts on food delivery, like not specifically HelloFresh, but something similar to HelloFresh, right? You get mail delivery to or food delivered to your house. Meal kits, things along those lines. Gym equipment, home gym equipment. They have discounts on that. Online fitness classes, things along those lines. Teledoc. So we talked about this a little bit earlier. $0 copay for most members with this. With that $0 copay too, I do want to throw in a caveat. Kind of the post-COVID world. Folks PCPs do offer a lot of virtual visits. That is still subject to the normal copay that you would see if you went in person. The $0 is only for Teledoc. So if they want to do the $0 virtual visit, it has to be through Teledoc. In their member portal, they would click. It says virtual 24/7 care. It links them to Teledoc. They just sign up real quick. They get in the queue to meet with a licensed physician. It's 24/7 help for non-emergency issues. I think it goes without saying, but if you feel like you're having a heart attack, don't do a virtual visit. More along the lines of, hey, I feel like I have a head cold, and I don't want to sit at the urgent care for an hour and a half, or go to the ER, or wait a week to get a visit with my PCP. As long as you have an internet connection, you can connect with an expert. So it really doesn't matter where you're at. I think it's great for, I live in a little bit more of a rural community these days. My PCP, he's awesome, but he's about a half hour away from me. I don't always want to have to drive a half hour to see him. I can do quick visits with licensed physicians. Like the example I used earlier, when you're having a sinus infection, they're able to write prescriptions if they see fit. You can avoid long wait times. Typically, it only takes about 10-15 minutes to get connected with somebody at the most. The other thing that Teledoc does offer is they do have mental health visits too. So if somebody's going through a mental health crisis, they need to talk to a therapist, they can do that through Teledoc as well. And then the member portal. So this is obviously member facing, but I think it's helpful for you guys to know to be able to assist your members when they have questions. A lot of the things, again, not that as brokers we don't want to help folks, but there is a lot that can be done in the member portal that I think sometimes they call agents for. They can change their PCP in here. They can view claims. They can order an ID card. They can get a digital version of the ID card. And again, we talked about the app earlier. The member portal is just is the app. The app is the member portal. So they can do it on the desktop, but they can also do it on the app. And again, you can save an ID card to your Apple Wallet. I think just going back to the portal, they can see where they're at towards their deductible. So through activity and usage, they'll see all their claims as we get them in there. Billing, you can pay premiums in here. You can roll in auto pay through here. Really anything that the member needs. They can also see pharmacy details in here. They can find a provider through here. So really anything that the member would need outside of certain questions along the lines of like claims. They can see all the claims data. If they ever have questions, they can call member services. Again, they can view their PCP, search for specialists, and then they can get help for a lot of frequently asked questions as well in here. And this is available for the iPhone and Android, so it's in the Apple Store and then also the Google Play Store. Ambetterhealth.com. That is our website. I think for you being brokers, your broker portal is going to have most of what you need. But the guide, so how to use it. So it's guide.ambetterhealth.com. Again, there's a link for you in your broker portal. A couple different ways. for members to do searches and for you to do searches. I would always recommend for members, they log in to their member portal, because what we do there is we pull all their plan data. Like I said, we do have some tiered and networks throughout the country. So if you log in as a member, you're going to see specifically, things that are associated with your network. Other ways you can search, and the last slide had it. You can select your state, select the plan year, select your county. It'll give you, it'll pull from the options of what's available in that county. Then you'll see this. This slide's a little bit dated. We don't have one for 2025, but what you'll see is that it'll say Premier. If you're talking about Georgia, for example, right? You'll see the Select network. You'll see the Premier network. So you select whatever is associated with the plan you're looking at. We give you the results based off of that. From there, you'll want to do a search. For this example, we did primary care in Miami, Florida. Whatever you select as your location, whether you pick a city, you drop a pin, you throw in a zip code, you throw in a county. That's where we basically just drop a pin on the map, and then we branch out from there as far as locations. So that's really the only rhyme or reason of how doctors are listed in our Find a Provider. There's not, we don't push other doctors more than others. It's really just based off your location. So for the most part, you have some of the quick hitting information along for the doctors here. But if you want to get a little bit more detail, you can click on View Profile. And it'll take you to this screen. So it gives you a little bit more in-depth on the provider. I mean, it has everything from, hours of operation, phone number, locations, if there are multiple locations, if they provided it to us, like what med school did they go to? If they speak multiple languages that they offered at the office, that's all going to be in here in the guide. And I think this is probably one of the last slides I have here for you today. The formulary list. So if you go to ambetterhealth.com, you click for members, it gives you a drop down. You want to hit drug coverage. It'll give you a list for the formulary. I think the 2025, if it's not already up in there, it should be any day now. We have that listed in a couple different languages too. So you click on that, it'll give you the PDF for the formulary list. And it's a large document. There's over 100 pages. I really don't think anybody wants to, and nor should you, read it word for word. If you hit Control F, it'll give you a search bar. You can type in the name of your medication. If you don't see it right off the bat, check for like a generic version of the drug. Sometimes we might not carry like the specific name brand or cover the specific name brand, but we do cover the generic. So if you don't see something right away, check for the generic version as well. A lot of times we do have that. And that breaks down everything I have on my end, so we can open up for questions.
Wow. Yeah, Mike, thanks so much, man. I was excited to get to this part of our call and just take a deep dive into all of the Ambetter products. I know that they're obviously very popular for all of our agents, and of course, Florida and all the states that you're in, you have such a wide network. So really great to have you on today. I'm very sure that we have questions for you. And if you haven't put in your questions yet for this Q&A, now's the time. You have direct access here to Ambetter, to Centene. You're going to get to have your questions answered right here and now, and not have to wait or go search in some form somewhere. So I'm going to open up to Michelle and Sarah to see what questions we have. While that's happening, I'm going to contact our next speaker, and we may have a little pause after. So Michelle, Sarah, take it away, please.
Thank you, Vince. We have a question. It says, how long after we enroll a member do they have to wait to register for their member portal? What info do they need to register their account?
Yeah, so that's a great question. Once you enroll somebody, it triggers in our system. So typically, especially during open enrollment, the marketplace is pretty good about sending us batches of files almost daily. We usually get 1 or 2 batches a day. When you're in the, you kind of get outside of open enrollment, the cadence changes a little bit. But, let's say that you enroll somebody on November 1st. What happens is we typically get that file either November 1st or 2nd. That triggers in our system to send out a welcome packet to the member. That's going to have information for them to create their member portal. What we do, their username is the email address associated with their marketplace file. But they'll get that welcome packet. They can create their member portal there. That welcome packet also gives them a lot of information on their plan. Also, details, again, setting up the member portal. If they haven't already done so, locking in their binder payment. And then just kind of to go a little bit further, once they make that binder payment, that's when we send out the ID card too. So typically, I would say within 5 to 7 business days, they'll get that from the time of enrollment.
Thank you. To be clear, do they need to receive their packet in the mail before they can make an account, or they're going to get an email asking them to register?
So they'll get the welcome packet asking them to register. I would have them hold. They probably don't need to necessarily wait for that packet, but I would not have them go like, okay, you enroll them and then go try to create the member portal, because especially if they're new, we're not going to have that file yet for anything in the system for us to recognize them as a member.
Thank you. And are they going to have to use the email address that they signed up with in order to create the account?
Yes.
Thank you. That's all the questions we have right now.
Okay, all right. Well, really, again, Michael, thank you so much, not only for your time, but for the time that you spent with us here these last couple of weeks getting this all set up. Really appreciate you jumping on today and providing, again, just more value to our agents prior to open enrollment. I'm sure it's going to come in real handy. So again, everyone, thank you, Michael, and Ambetter Health.